Dear students, welcome back. Now in this session we are going to discuss about the knee joint capsule and the ligaments. So now we will see the capsular attachments. So the fibrous capsule is very thin and is deficient anteriorly. So the green lines which implies the attachments of the capsule here. So this is the anterior aspect of the femur and posterior aspect of the femur, and this one is anterior aspect of the tibia and posterior aspect of the tibia. So anteriorly the fibrous capsule which is deficient. So here you can see there is no capsular attachment here, where it is replaced by the quadriceps femoris, the patella and the ligamentum patellae. Okay. Yes. Now we will see the femoral attachments of the knee joint capsule. Anteriorly it is deficient. Okay. Anteriorly it is deficient. And it is attached about half to 1 centimeter beyond the articular margins. So half to 1 centimeter beyond the articular margins. Okay. So these attachments will have special features. One is anteriorly it is deficient, and posteriorly, so come to here, posteriorly it is attached to the intercondylar line. Posteriorly it is attached to the intercondylar line. And if we see laterally, so laterally it is enclosing the origin of popliteus. Laterally it is enclosing the origin of the popliteus muscle. Okay, these are the femoral attachments. Okay. Now we'll see the tibial attachments. It is attached about half to 1 centimeter beyond the articular margins. Half to 1 centimeters beyond the articular margins. The attachments also having 3 special features. Anteriorly, it descends along the margins of the condyles to the tibial tuberosity. This will descends like this according to the up to the tibial tuberosity. Okay. And where it is deficient, so over the tibial tuberosity, the capsular attachment we can't find, because here we can see the attachment of the ligamentum patellae there. Okay. And posteriorly, come to posteriorly, it is attached to the intercondylar line. Okay, posteriorly it is attached to the intercondylar ridge, which limits the attachment of posterior cruciate ligaments. So this one is the posterior cruciate ligament, and the capsule also limits the attachment of the posterior cruciate ligament. If you see on the lateral aspect, posterolateral aspect, there is a gap behind the lateral condyle. Okay, for the passage of the tendon of the popliteus. For the passage of the tendon of the popliteus. So these are all the attachments of the knee joint capsule. If you see overall attachment of the knee joint capsule, it is attached about half to 1 centimeter beyond the articular margins, and it is having some deficient places on the anterior aspect, both in femur as well as in the tibia. Okay. And posterolaterally it is having again opening for the passage of the tendon of popliteus. So these are some of the important features of the knee joint capsule. Now we will move on to the other ligaments. Okay, so now we have seen, so this is the capsular ligament. This dotted lines are the capsular ligament. So the ligaments which are present outside the capsular ligament, those ligaments are called as extracapsular ligament. The ligaments which are present inside the capsule, are called as intracapsular ligaments. So around the knee joint there are a number of ligaments, up to 10 ligaments are there. Okay, out of these 10 ligaments, 5 ligaments are extracapsular and 5 ligaments are intracapsular ligaments. Okay, so the extracapsular ligaments are tibial collateral ligament, okay, and fibular collateral ligaments, tibial collateral ligaments, fibular collateral ligaments, and ligamentum patellae. So here you can find the ligamentum patellae, okay, and oblique popliteal ligament, okay, and also arcuate ligament. So these are the 5 extracapsular ligaments. Now in the next session we are going to discuss about all these extracapsular ligaments. Thank you.